Good day, everyone! I am Lenica Jaira Marcos from the AUL Life Science Group 1, and today I am going to present to you our revised and improved presentation of our ideation process about our topic of interest titled Epidemiology, Transmission and Control of the COVID-19 in Various Age Groups. Before I formally start my presentation, here's what I'm gonna discuss today. First, what do we know about the topic? Second, known issues or arguments about the topic. Third, questions we have that need answers which could only be achieved through research. Fourth, importance to the community. Fifth, is this researchable and why? Sixth, type of study. Seventh, area of study. And lastly, highlights of our revised ideation process. To begin with, let's start with what we know about the topic. Epidemiology came from the words epi, which means upon, demos, which means people or population, and logos, which means the study of. And if we're going to translate it, epidemiology is the study upon population. In definition, epidemiology is a study which should be scientific, systematic, and data-driven of the distribution, which are the frequency and pattern, and determinants, which are the causes and risk factors of health-related states and events, not just diseases, in specified populations like neighborhood, school, city, state, country, and global. Next, coronavirus disease or COVID-19 is an infectious disease caused by SARS-CoV-2. You can be infected by breathing in the virus if you are within close proximity of someone who has COVID-19 or by touching a contaminated surface and then your eyes, nose, or mouth. Other factors that could affect the transmission of virus are crowded places, confined or enclosed spaces with poor ventilation and close contact settings. Some of its symptoms are fever or chills, cough, shortness of breath or difficulty in breathing, fatigue, muscle or body aches, headache, loss of taste or smell, runny nose, sore throat, nausea or vomiting, and diarrhea. Therefore, to control the transmission of COVID-19, the authorities advise us to avoid social gatherings and crowded areas, follow the community quarantine measures, and seek medical attention when exposed to the disease. Following that are the various age groups. Based on the discussions on our previous years, people are divided into 7 age groups. First group is the infant or the babies aged 0 to 1 year old. Here, the baby's early nutrition, activity, and wellness can contribute to a strong or fragile health foundation that will affect the rest of his or her life. Second is toddlers aged 2 to 4 years old. During this time, his or her physical growth and motor development will slow, but you can expect to see some tremendous intellectual, social, and emotional changes. While child visits are important, here, he or she will get his or her vaccines and routine exams and screenings. The third group is children aged 5 to 12 years old. These are some of the most active years physically and mentally. It is important for them to eat healthy foods, making sure they get enough sleep and exercise, and to get their regular checkups with their pediatrician. The fourth one, which is where we are right now, is the teens aged 13 to 19 years old. At this age, adolescents experience rapid physical, cognitive, and psychosocial growth. This affects how they feel, think, make decisions, and interact with the world around them. Next is the adult age group, which consists of people aged 20 to 39 years old. This is the time where people build their families and careers. Regular physical exams and adult health screening tests are an important part of preventive adult healthcare. 6 is the middle-aged adults, which is made up of those 40 to 59 years old. Some says that this is the happiest age group where they have found success and financial stability, their families are grown, and they generally have less uncertainty in life. But there are also some health problems that come in this age, such as heart problems, cancer, hypertension, stroke, and diabetes. And last but not the least is the senior adults who are 60 years old and above. For people to enjoy these years to the fullest, they need to be at their healthiest. However, this is also where the complications can totally be seen. Common conditions in older age include hearing loss, cataracts and refractive errors, back and neck pain and osteoarthritis, chronic obstructive pulmonary disease, diabetes, depression, and dementia. This is probably because as we get older, the immune system becomes less able to distinguish foreign antigens, and antibodies that respond to them slow down too. Following that, let's tackle the known issues and arguments about the topic. According to CDC, or Center for Disease Control and Prevention, severe illness from COVID-19 is prone to those aged 85 and older. And in the Philippines, the most affected age group by the virus is those from 20 to 29 years old. Meanwhile, the most diseased age group are those over 70 years, based on the World Health Organization report. Also, far fewer cases of coronavirus or COVID-19 have been reported in children than in adults. Usually, the virus causes a milder illness in kids, though some children have become pretty sick. And based on a study from Denmark, results found out that reinfections of COVID-19 are unlikely, especially for people under 65 years old with 80% protection, while those who are above 65 have only 47%. Furthermore, large numbers of cases in children aged 0 to 9 were asymptomatic or had only one symptom and resulted in fever as the most common symptom. COVID-19 cases in children were more likely to be milder symptomatic, with cough not seen as frequently as in adults aged over 40. Lastly, a study from Italy found out that out of 2,824 individuals with known coronavirus infections, only 876 or 31% of the individuals had presented any symptoms. And when they look at the age data, 81.9% of the people aged 20 years and under were asymptomatic. Now that we've already discussed the prior knowledge and the known issues or arguments about the topic, let's now talk about the questions our group has that can only be answered through research. What age groups are more and less vulnerable in catching the disease or virus? Are the symptoms or effects of the virus much greater in a specific age group rather than other age groups? Does the vulnerability or risk level change from time to time? What are the possible explanations? Are there different quarantine, isolation, and vaccine procedures when it comes to children and adults? Are there other emerging measures that can be considered to strengthen the protection for all age groups, especially the most exposed ones? And lastly, does a person's age have an impact on how long it takes for them to recover from COVID-19? After that is the importance of this topic to the community. By assessing if age has an effect in the transmission and control of the COVID-19 virus, we can improve the protection of those who are more prone to catching the virus. This is not to say that only one group should be cautious as we are all at risk, but to further control the spread of the virus. It can help in improving the community quarantine measures and bring information to people and to the future researchers who also want to help in improving the protection from the virus. It is also extremely necessary for published studies to be reviewed so that identifying changes, developments, differences, patterns, and trends will be possible. Therefore, new solutions can also be provided based on the interpreted data. Plus, those studies may differ from the duration of the experiment, methodology used, and study population. Thus, there will be a broad conclusion applicable depending on the said differences for each research study. And of course, before we can research this topic, we need to answer first the question, is this researchable? And our group's answer to that is yes, this topic is totally researchable, and I provide 5 reasons why. First, there is a lot of existing literature and studies covering the said topic with different methodology, study population, results, and conclusions that we can use for the systematic review. Second, it would also be more efficient to analyze data and identify research gaps that need further investigation. By identifying the research gaps, we identify a direction for potentially new and exciting research. Third, this topic is also budget-friendly. And fourth, easier to be done, especially in this time of pandemic where we cannot go to laboratories and meet up to do experiments. What we need are paper, a pen, a laptop, or any gadget to surf on the internet, and our curious minds to dive in and read and analyze different studies and information. Lastly, this research could be done in our own home at our most convenient time. There is no strict schedule to follow. It is also much easier for us to communicate and divide the task to each other with the said topic. And for the type of study we'll use to answer our questions, we will do a systematic review or research analysis where we will look for different studies, articles, and literature regarding our topic. Obviously, this topic cannot be experimental because we cannot expose participants to the virus. The best way to answer these questions is to gather information and assess and evaluate those informations to arrive at a conclusion. We will analyze and compare the literature by getting the important ideas, findings, and limitations in the literature. Then, we'll compare it to arrive at a conclusion. And we'll probably not use statistics but rather more of comparing and evaluating ideas and information. For this research, we plan to use 7 to 20 articles for the systematic review. Also, an article from Canberra University suggested that for undergraduate review, you can use 5 to 20 articles depending on the level. And lastly, for the area of study, this topic falls into life science because, of course, it's study about life and living organisms such as the people in various age groups and the COVID-19 virus, but specifically epidemiology, since epidemiology is the branch of science which deals with the incidence, distribution, and possible control of diseases and other factors relating to health. This topic wants to learn more about the age effects in transmission and control of COVID-19. That's why this topic is covered by epidemiology, since it digs deeper about how the virus occurs or transmits in different age group of people, the possible reasons behind it, to understand better the virus and provide new solutions in improving the control of the disease. Before I end my presentation, I just want to highlight the revisions I did for our ideation process. Also, I would like to thank our classmates who gave their questions and clarifications on the initial presentation. It was a great help in improving our ideation process. Again, I thank you all. The question that was raised during the first presentation is, what will be the difference of our study from other studies since we will just use other studies' data for our research? The first difference is on how we will execute the research or the methodology. Other studies might have used descriptive, correlational, or experimental research, but ours will use a systematic review. I've also added more explanation about what we plan to do in the type of study to better understand the methodology. Second, we've also narrowed our topic specifically on the transmission and control of the COVID-19 in various age groups, which I think will make a lot of difference with other studies. Inclined with that, I've also included prior knowledge about COVID-19 in the various age groups and revised the transmission and control of the virus in the What Do We Know About the Topic section. I've also elaborated more about the importance of the topic and the area of study for further understanding about the topic. Here's also the citation of the articles and studies I've used for the presentation. If you have further clarifications or questions, don't hesitate to comment below or in the Padlet board comment section and I'll gladly answer it. And that's the end of my presentation. Thank you for listening.